Welcome to Medical Insurance for Pharmacy Technicians. Let's begin with Chapter 1, From Prescription to Payment, Becoming a Pharmacy Technician Insurance Specialist. So why do you have to learn about insurance? There are several types of insurance, from auto, homeowners to life insurance. Medical and prescription insurance will be the most common that you will be dealing with as pharmacy techs. Becoming an expert with the many types of prescription insurance will come with time, but understanding the basic setup of medical and prescription insurance coverage will help you along your journey to becoming an expert. Prescription insurance allows patients to reduce their cost to acquire prescribed medications. There are several types of insurance companies that do this within the U.S. As a pharmacy tech, you will need to familiarize yourself with the variety of prescription insurance plans. So let's start with the insurance basics. Healthcare costs can be very expensive. Medical insurance helps to keep these costs to a minimum for the patient. The patient who has insurance is called the policyholder. They're the one who is covered by the health plan, which provides the insurance. Health plans require policyholders to pay a premium. This is usually a monthly charge to keep the insurance benefits active. These insurance benefits are what the health plan pays for if the policyholder uses any medical services. Benefits from the health plan typically cover costs from hospitals, physicians, and prescription medications if their plan includes this. So what is covered by insurance? Well, not all health plans pay benefits for everything. Health plans determine if they will pay benefits based off medical necessity. Being medically necessary means that the service being billed to the health plan must meet certain criteria. The criteria for such classification are that it must match the patient's illness, it must not be elective. Elective services are ones that the patient does not need in order to maintain health. It must not be experimental, and it is furnished at an appropriate level. Being furnished at an appropriate level means there is no excessive waste of health services on a simple diagnosis. So a simple diagnosis equals a simple treatment. Most health plans will pay benefits for common preventative services such as annual physicals, mammograms, prenatal care, and several other services specifically designed to catch illnesses early on. Most health plans provide benefits both for medical services as well as prescription drugs. Health plan policies that have a pharmacy benefit are specifically designed to provide coverage for selected prescription medications. Remember that the medical benefits will only provide benefits if services meet certain criteria. Well, pharmacy benefits work in a similar way. Not all prescription medications will be covered by the health plan. A preferred drug list, sometimes called a PDL, but is more often called a formulary, exists with every pharmacy benefit. The formulary is the health plan's list of medications which it will pay benefits for. The formulary usually contains at least one medication in each major class of drugs. That way there is always a first option for the patient to try out. Formularies only contain FDA-approved brand name and generic medications that the health plan will pay for. The health plan will either pay partially or in full for each medication on its formulary. Most health plan formularies these days can be accessed online. However, more often than not, you will only find out if something exists on a patient's formulary when you receive a prescription and attempt to run it past their insurance. From here, you will either get a paid claim for the medication or you get a reject, which states something along the lines of product not on formulary or product not covered.
Health insurance can help you pay for medicines that are prescribed by your doctor. Knowing what's covered can be complicated. Given many of us take prescription medications regularly, it's worth checking to see if and how each is covered by your plan. Each plan has a unique list of medicines that are covered. This is called a formulary. If your medicine's not covered, you may have to pay the full cost yourself, or go through a lengthy process to get your insurer to consider covering it. Covered medicines are often divided into tiers, usually 4 or 5. Insurers can choose how they create their tiers and what medicines go on what tier. The amount you pay at the pharmacy is based on which tier your medicine is placed. Lower tiers, like Tier 1 or 2, typically are a fixed copay of $10 to $50. In higher tiers, you'll likely have to pay coinsurance, or a percentage of the cost of the medicine. This amount varies based on the cost of the medicine and may be harder to predict. Sometimes your plan may require that you try medicines on lower tiers first before getting coverage for a medicine on a higher tier. This is called step therapy. Before choosing a plan, be sure to find out how it covers the medicines you need.